This is the Plastic Principle.
All right, everyone. Welcome to the Plastic Principle podcast. I am Dr. John Diaz, a board-certified plastic surgeon here in Beverly Hills. And I have a very special episode today because we're talking about a topic that is very important and at the core of plastic surgery, but seldom discussed. And I think a lot of patients have a lot of misunderstandings about it. There are a lot of myths about it. And I think we're going to get tremendous clarity and great information today because I have a very special guest, Dr. Daneshrad, who is an incredibly trained, highly skilled MD anesthesiologist who has worked with me now for a while.
Yeah.
And I think it's a pleasure always working with her because I think she's just a source of just such incredible professionalism and skill. And so it's really an honor to have you here today.
Well, thank you for having me.
Yeah.
It's been, the way I look at time now is pre-pandemic or post-pandemic. And we've known each other pre-pandemic.
Wow, that's right. That's like a milestone. That's like a landmark.
That is the landmark in time now that I, when did we meet?
So we must have been, it's been, how long do you think we've been working? Maybe 4 or 5 years together?
I would say probably closer to 6 or 7.
Has it been that
I know.
long?
It's
Wow.
just, I'm so lovely that it just feels like.
Time flies.
Yes.
By the way, Dr. Daneshrad, who goes by Dr. Diba.
Yes.
Because your first name is Diba.
That is my first name. Like a diva.
Exactly. Has an incredible sense of humor.
Yes.
And so maybe, I'm sure we'll see a little bit of that today. I think we're seeing it already, but we'll see more. So, Dr. Diba, may I call you that?
Yeah, of course.
Why don't we begin by sharing with the audience and the listeners kind of a little bit about your background and why you are such an authority to talk about this subject.
Okay, so I went to, I'm actually native of Los Angeles, but I went away for college, med school. I went to Wellesley for undergrad. I went to Tulane for medical school. And now, after that, I went to residency at Columbia.
I think I've heard of these
yeah,
institutions.
Yeah,
you might have
you've
heard
been there. Yeah. And then I actually, I'll be honest, anesthesia scared the crap out of me.
Yeah.
Like literally, like I'm in charge of someone's life.
Yes.
And like I make a mistake, they could die.
Yes.
And I was like, you know what? If I'm going to take care of patients, I'm going to take care of the sickest patients. So I did a fellowship in open heart surgery.
All right.
And that was also at Columbia, where they were the #1 heart transplant center in the country that year. So I did a lot of cases then. And then I came here and I worked at Cedars-Sinai for almost 10 years. And after that is where I ended up finding you, was when I, 3 kids later, I needed to, change my life a little bit.
Yeah.
But I have to say, like doing those type of surgeries, I can do anesthesia for almost anything now.
Absolutely. Yeah. And I think that background is so unique. And I think it's important to emphasize to the listener that doing anesthesia for cardiac patients, this is patients who are undergoing heart surgery. It is probably one of the most stressful, difficult, challenging kinds of surgeries to do. And so your career has followed the career that many doctors follow, which is, when you're starting out, you want those challenges and you do those 100%. Hard cases. But it's a very difficult lifestyle to sustain, 100%. Especially if you have a family, and you definitely are a family person. And I know about your family and your daughters, and it was important for you to be there for them. And I think that your path makes perfect sense. And it's no mystery why you would want to try to find a career now or a path where you can have a little bit more of a scheduled type of surgery, for surgery.
I mean, transplants would happen in the middle of the night. I would be taking weekend calls. I wasn't there for the soccer games, all of that, which is fine because when kids are little, I kind of feel like, they don't need as much guidance. But like now that my girls are getting older, I don't want to raise assholes. So I kind of want to be around, hoping that like me being around makes them less.
Absolutely. Well, the apple doesn't fall far from a tree, so I have no worries and no doubt that your daughters are not going to be as amazing as you. Yeah, but see, that's one of the things when we started working together, I was really impressed with you because of that background and that knowledge and that skill set you bring. So that's why I think anyone listening knows that what you're going to be sharing with us today, I mean, this is coming from an incredibly credible source. You know what you're talking about. You've seen it, you've done it.
Oh, 100%. And, you know, having worked at Cedars, we would see some of the stuff that would come from the community over.
Right.
And, you know, it's good to be in, you know, a surgery center that's so close to a major hospital.
Right.
God forbid something happens.
Right.
But like, those are the things that I'm comfortable with is when the God forbid something happens.
Right. And I think one of the other things we share is we both are the kinds of people that we adhere to the highest standards for everything.
I mean, didn't we do that the other week?
That's right.
When we had that patient?
That's right.
Where I was like, John, I'm kind of worried here.
That's right.
This isn't normal. His rhythm was a little off.
That's
and
right.
We both were like, we don't need to take this risk.
That's right. I think, thank you for bringing that up because that's an important point and we should share that. So just recently, Dr. Diba and I were working together. We were doing a couple of surgeries and it was one of our later cases of the day. And the patient was checking in and had a medical history he did not share with us. And it turned out it was something that, you know, could be potentially a problem. I don't want to get into details,
of course.
But you recognized it, came to me, and then I went and examined him and confirmed your findings. And together we said, this is not a safe time for you to proceed because of these findings. And we recommend that we should postpone the surgery and do it another time. And that's something sometimes patients don't understand why, what distinguishes, like, let's say an average doctor from a really caring, superior type of doctor care. Because that is, I tell patients, when you're having cosmetic surgery, it's very easy to think like, oh, it's just cosmetic surgery. It's like, whatever, I'm getting a haircut or I'm getting, you know, some cosmetic treatment. But I always tell patients, there are so many things that I am thinking about behind the scenes that are in the back of my mind that are not even on your radar about your health, your well-being, making sure that not only do you go into surgery in the best way possible, but come out in the best way possible with the best outcome long-term. I mean, these are all the things we think about.
Oh yeah.
Yeah.
So this like reminds me of when I used to teach residents, I would say, you know, when I get up in the morning, I think about how someone is going to try to kill my patient today. And they're like, what? I'm like, that's our job as anesthesiologists. Plan A, plan B, plan C, and just keep going.
Right.
And so I literally feel like the ninja, like doing this with like everything coming at me, being like, oh, I can see that coming. So instead of dealing with the repercussions of that problem, I'm going to avoid it completely because I've thought about it in advance.
Yeah. Same with surgeons. That's how we're trained. We're trained to always have backup plans. Always think of you always plan for the best, but you always prepare for the worst. And these are the things we're constantly thinking about. And anesthesiologists and surgeons work very closely together. 100%. All the time. And it's one of the things that I'm proud of in my practice because I always try to find the best people to work with. And that's why I enjoy working with you so much.
Oh my gosh, thank you.
So the reason I brought you on today is because anesthesia is one of the things that patients are just so mystified about. They're confused. There are so many myths, misunderstandings. And very often in the consultation, after I complete like the major parts of like discussing like, okay, what implant do you want or what's the plan? Inevitably, the day of the surgery comes and or the questions about the surgery come up. And one of the biggest things they ask about is fears they have about anesthesia. So what I hope to do today is maybe dismiss or deal with some of these myths. Let's address them and let's give patients, anyone listening, like the actual real deal information about what they should know about anesthesia.
Okay.
Sounds good?
Sounds great.
So let me tell you a couple of things that patients sometimes share with me.
Okay.
So when we start talking about surgery and recovery, and I tell them that we're doing general anesthesia, I have many patients who will say, oh, well, I really don't want to have general anesthesia. I saw this other doctor, I heard this other doctor say that he can do the whole thing under local. And what I often tell them is, although it sounds better, I get it from the perspective of someone that doesn't know anesthesia. General anesthesia sometimes is much safer.
100%.
So
and
can
it's
you
not. So here's the thing with general anesthesia versus local. So if you're doing it under local, you're responsible for the patient the entire time, right? Because there's not an anesthesiologist there.
Right. The surgeon is.
So the surgeon is responsible. So basically, you have one doctor who is responsible for your vital signs, making sure that you are not feeling anything, that your blood pressure is normal, your heart rate is normal, you're oxygenating, everything is going smoothly while paying attention to their operation.
And now, and just to pause for a moment. Now, for simple things, that's fine. So, for
Right.
example, if I'm fixing a laceration,
Oh,
I'm taking
100%.
out a mole, I'm doing a little, a revision of some scar. Like I do that all the time under
Right.
local. That is not an issue whatsoever. I'm talking about long liposuction cases, breast augmentation surgeries, things of that nature. Facelifts, exactly. Yeah. So you're 100% right. If it's under local, that's a good point. You have one doctor, not two.
Not two. And
Right.
so you have, like, when we're working, what's alleviated for you, you don't even have to worry about the patient being safe, being alive, being well taken care of. That's not on your radar. When you were talking about the different things that are on your radar, it's all related to your surgical technique.
The surgeon can be focused on what they're doing. Yeah.
And so that's really important.
Right.
So that's one.
Yeah.
Number two is, well, the local that you can give. Yes, there are things you can do when you give local, but you're not taking away all of the pain and everything.
That's right.
It's not completely gone. You're with it. You might have some sedatives, but it's not a complete anesthetic where you're dissociated.
I tell patients this all the time with liposuction. You know this. Most surgeons really dislike doing long liposuction under local because you're 100% right. You cannot anesthetize. You can't completely numb all of the millions of nerves that are running throughout the body. And so inevitably patients will have pain.
Yeah.
Even though I'll share one story with you, and I'm sharing because I think it's illustrative of what I'm trying to say. I had a patient who came to me for revision after liposuction. So she went to a big chain, which I won't name. And she said, I went to them because I saw these videos on Instagram of patients like giving the thumbs up, how great it was under local. They're like, I don't even feel a thing, and blah, blah. And she's like, Dr. Diaz, it was the most miserable experience of my life. She said the whole time they were doing it, I was in extreme pain, but I got a discount in exchange for doing social media. And because she was a very pretty, attractive young woman, and which is, these companies love that for social media.
Of course.
So she said the whole time she was in extreme pain, she said they would stop, give her like a minute to recover, and then say, okay, let's do another video. Give us a thumbs up, smile, tell us how great it is. And she's like, and I would do it because I was under pressure because they gave me this big discount. And then as soon as I did the video, they would start again and I'd be like almost crying. And I'm like, exactly. That's what people don't realize. Sometimes what you see on social media of how easy and great it is under local, it's not the truth.
Well, social media, we know, can be very deceiving.
Right.
And that's across the board for everything. But as far as like, this is something you're doing with your body, like you get discount shoes.
Right.
You don't get discount body procedures. You know what I mean?
Yes.
Like, I love my deal.
Yeah.
I love a deal.
Yeah.
I'm not getting it on my
If you know Diva, she loves a shopping deal. That's for sure.
100%. 100%.
Right.
But it's not going to be with my
Right.
face, with my body, none of that.
Right.
Like, that's
Right.
where I kind of draw the line.
Yeah, absolutely. And a lot of patients bring this up. They'll say, well, why, I went to this doctor and he's half the price. And I often remind them that, again, you have to think about all of the things that are going into surgery, like we just said, all the things you're thinking about, all the things I'm thinking about. So when you're paying for your surgery, now obviously no one is saying you have to pay the most, but there is this correlation between quality and the price of the surgery. And if something sounds too good to be true and it's too cheap, it's
100%.
probably because it is too good to be true and there's probably some catch.
Oh yeah, and I've worked at some of those places, which I didn't realize were kind of those
factories or whatever.
yeah, exactly. And I would tell the surgeon, I'm like, we need to stop. Like, you're doing too much lipo. Like, this is not safe. And they wouldn't listen to me. And I was like, okay, I mean, I don't need to go back there.
Right.
Like, I'm not going to work there.
Right.
There, I did not become a doctor to be a businesswoman, to make it rich. Like, I did it because I love doing what I'm doing.
Right.
And it's nice. Like, I actually do help people.
Yes.
Like, there's a beginning and end to it. And it's really nice, and it really feels good when I go home. Like, I love that.
Yeah. And you're wonderful with patients.
Oh, that's great. Because I don't know. I never see them afterwards,
we get the privileged surgeons to like see patients through this whole journey. Anesthesiologists have this very limited interaction. Yeah. But we hear it. We're like, oh my God, that anesthesiologist was so nice. Please tell her I said thank you.
Oh, okay, great. Oh, wow. Thank you.
So going back to this local thing. So you mentioned the fact that there's 2 doctors. That's
That's
great.
huge.
I'd rather have 2 rather than 1. And we talked about the fact that without the general, it's hard to get complete anesthesia.
Right. And then the other thing I was going to say is, because you don't have the complete anesthesia, your body gets a little revved up.
Mm-hmm.
And I mean, it's kind of hard to explain like physiology, but like your sympathetic system jumps up.
Yeah,
and
heart rate goes up, blood pressure goes up.
And those things can cause complications in and of itself, just because you're awake and a little revved up.
Right, that's right. Stimulated, very stimulated.
Exactly.
Fear, anxiety. I mean, I've had patients getting things in the local and they're like, oh my God, I didn't I'd hear this after, or maybe they tell me from other experiences where like, I didn't realize like I would actually see my blood. I'm like, well, I mean, if the surgeon has a gauze and you're awake, and let me tell you, for a lot of, I mean, we're used to it, but for a lot of people, that's extremely disturbing to see.
I know. My husband, Rudy, disturbed by his own blood.
Right. Most non-doctors are.
Totally disturbed by his own blood.
The other thing I bring up with patients when we do procedures, when they want procedures under local, is I talk about the oxygenation, the control of the breathing. Maybe can you touch on that?
So when you're under general anesthesia, you get 100% oxygen being delivered to your lungs, which then gets delivered to all of your blood vessels, and we monitor your oxygen saturation. And it's a closed system. I'm not worried about fires or anything like that, because the supplemental oxygen isn't from nasal cannula. It's a very safe environment. It's closed, it's controlled, and you're getting more than you could if you're getting extra with a nasal cannula. I mean, I don't know how well you can be sedated and oxygenated doing some of these larger cases with just local.
Yeah.
I mean, you give them a little bit of, Ativan or something, and something for pain, but still you're not getting something systemically to give you that dissociative state. And I wouldn't do it for myself. I would not recommend it to anyone I know.
It's funny you say that, because a lot of us, I always try to give analogies in there. Every person who's in their certain industry, there's the inside scoop, right? That you only know because you're in that industry. And one of the things that we know in our industry of medicine and surgery is that most surgeons and most anesthesiologists, if you were to ask them how you would want your surgery done, I think universally everyone would say, I want general anesthesia.
100%. 100%.
So that alone is telling, right?
Oh, yeah. Yeah, there's no way. There was the time where I wanted my mommy makeover. There is no way I would have done that under local. Not feasible, not going to happen. Yeah. Now I want a facelift. Life moves on.
You're like, okay.
Okay. I'm over that. Next thing.
Right. So that's another thing I tell patients, when you're under general anesthesia for a big procedure, it's much better control of your vitals, like you said.
100%.
Much better control of your oxygen. When you're awake, and you're half asleep, half awake, your breathing slows down. Sometimes you don't take a deep breath, your oxygen levels drop. There's all these fluctuations that we don't have when, let's say, you're doing a surgery with
And
me.
you have to be paying attention to that
Right.
while you're doing the surgery.
That's right. That's right. Instead of having that other professional. Yeah.
Right.
Yeah.
I mean, you might have a nurse but they're not trained in anesthesia who's doing that. You're doing it under local, and you're like, that is a lot of responsibility for one person.
Yeah.
I wouldn't trust that at all.
So this begs the question. I know the answer, or at least I have my own answer. So why do you think, what is your theory as to why some surgeons offer local for a lot of these procedures?
Well, I think one is, and rightfully so, like, people are worried about anesthesia. Like, let's think about this. Someone gives you some drugs. You go into a dissociative
It is kind of crazy.
Right? Like, you're like, okay, see you later. Gives you drugs.
Yeah.
You're totally out of it. You have no idea time has lapsed. You wake up all groggy and, like, with new boobs or, whatever you've come in for. Like, it totally, like, it's crazy.
It is.
And the thing is, lay people or, like, the general public does not know how safe anesthesia is,
Right.
especially when you have a board certified anesthesiologist taking care of you. Like, when you have a second anesthesia provider, it makes a huge difference.
Mm-hmm.
And, like, that's my job. It's like, I tell patients, like, my job is to be the Jewish mom at work and at home, because at work I'm worrying about you.
Yeah.
That's all I do.
Yeah, that's
you
true.
don't need to worry today.
That's true.
I get to worry about you. It's wonderful.
Yeah.
And so when they're telling, they don't want to have that conversation with their patients, saying, like, it's safe. Here's another person who's going to worry about you, who's going to take care of you, but you also have to pay them too.
Well, that gets to the second thing, right?
Yeah.
So my theory is, and this is what I would tell a lot of patients, and I base this on the fact that there are chains around the country and here in LA. And in particular, there's one, I won't name it, but they specialize in liposuction. And one of the things that they advertise is that everything is under local. And this is a selling point for them. It's under local, it's safe. But what they don't share is that when it was started by someone that was not qualified to give anesthesia and could not offer anesthesia. That was the reason why it wasn't given. Now, it turns out that it saves a lot of money not to give anesthesia.
Of course. I'm not sure if you guys can tell, but I don't come cheap, okay?
Diba is a very well-dressed and very classy anesthesiologist.
Yes, that's me.
No, but you provide an incredibly high level of care and service, and as any professional who does a very high level of care, provides a very high level of service, you're going to be compensated well for that. And as a surgeon, I'm happy to do that for you.
100%.
I'm happy to pay your fee because I think it's worth it. But I think it is worth noting that not every surgeon, but there are many surgeons who do things under local, and it's not because they think it's better for the patient.
No, it's to avoid me.
It's to avoid.
I mean, it is, and it's true. But think about it. As a patient, do you want to be awake and in pain? Because no matter how much local you use, you're still going to feel it.
You're going to feel something.
You're going to feel something.
That's right.
And it's crazy to me with liposuction and the local anesthetic toxicity that they would even consider doing that under local.
That's right.
That's just crazy talk.
That's right.
To me.
So it's funny you mention that, because one of the interesting things is in liposuction, there's a technique we refer to as tumescent. Mm-hmm. Tumescent means that the surgeon injects a tremendous amount of fluid, usually 3 times as much fluid as they expect to remove.
Oh, wow.
And the reason this developed was not because of any, surgical reason. It was because the person that developed it was a dermatologist who could not give anesthesia because he wasn't a surgeon. So he came up with this way of basically flooding the area with local.
Yeah.
And it turns out that if you flood the area with local, like a local solution is the solution that contains the numbing medication. It turns out if you flood an area with a tremendous amount of fluid to the point where it's basically bursting, you've seen this.
Yeah.
You can numb it pretty well. But then you get into the problem of what you just said, which is toxicity, because every medication we give has a risk, if you give excessive doses of it, of being toxic.
And that's one of the things we're taught in anesthesia school is local anesthetic toxicity.
Yeah.
So like I'm trained to know, to recognize it, to know when it is, how to treat it.
Yeah.
And, you know, when it's really an emergency versus like something I would not be able to take care of.
Yeah.
I mean, that's what I'm trained to do. Like to imagine someone who's not, they probably don't even know what the toxic level of lidocaine that they can administer.
Yeah. This is.
Do you know what I mean?
Yeah.
Like,
These are like very sophisticated calculations sometimes you have to make, right?
Oh yeah. And then that's what I not just for plastic surgery, but for other surgeries, like they'll be like, how much local can I use? I'm like, great, I'm your calculator too. But that's what I'm there for. Because it's like a little, you know, I don't even have to, I don't even have to Google it. It's like, here's your answer.
Right. So this is great. I think we have tackled a very big part of one of the biggest myths of surgery and anesthesia is this idea like local is safer. So I think we've shared a lot of information, and the summary basically is for little tiny surgeries, little tiny things, a little revision, a little area of liposuction, maybe a mole removal, laceration. Local is 100% totally fine. But for bigger surgeries, I think it's worth really thinking carefully about that and really asking your surgeon why. What are the real reasons why they're recommending local instead of general? Yeah.
No, I totally agree. Because I mean, it shouldn't be like, as I said, get your shoes discounted. Do not get your plastic surgery at a discount.
Do not get your anesthesia discounted.
No.
So the other big thing after that's covered, the next big thing patients tell me is, well, I saw or I heard that you can wake up in the middle of surgery. Right.
Okay, it really does not happen.
Yeah.
The times that it does happen, which since I do open heart surgery, is in cases like that. It's like a life or death event. Like you're under anesthesia, it lowers your blood pressure. I'm going to turn off the anesthesia so I can save your life.
Right. Because the anesthesia lowers your vitals, right? So in a big, massive,
like a huge surgery where like, you
may have to turn it down.
And that's happened like twice in the last 15 years that I've practiced.
Probably thousands and thousands, if
more
not,
than that.
Right.
Yeah.
10,000 cases. Right.
And in both of them were open heart surgery.
Right. And it was because if you didn't, the person was going to die.
Right. So like I made that decision.
Yeah. I wouldn't mind waking up a little bit for that.
Yeah, exactly. Right. But for this kind of surgery,
it's unheard of.
No.
Yeah.
No, there's no reason. Like, I can't even imagine. Like, your patient population is young, healthy. They've gone to get all of their preoperative work.
Right.
They have everything tested. Right. Like, I am not worried. Like, I mean, I worry, but I am really not worried about your patient population because I know that they are being taken care of.
Right.
They've done everything they need to do. All my T's are crossed. My I's are dotted.
Right.
Like I'm like a happy camper. You see me when I come here.
Yeah.
I'm happy.
Yeah.
You're like,
well, I always tell patients, if I'm not worried, you don't have to be worried.
Right.
And I'm definitely not worried about you waking up in anesthesia because
100%.
I know how extremely rare that is. And to your point, one of the things I do in my practice that any surgeon should do is when I'm doing consultations, I'm always asking their medical history, what medications are you on, what surgery, and I'm trying to figure out, is there any risk factor here? Is there anything that could affect the anesthesia, give us an issue or whatever? And to your, what you said, most of our patients are completely healthy. And if they're not, if there's some issue, they get checked out. We send them for medical
100%.
clearance. Right? So all of this stuff is worked out before the surgery.
So I know going in, like this patient's blood pressure is not going to drop.
Right.
I'm not going to be worried about having to decrease my anesthetic.
Right.
And we have plenty of anesthesia here, in case you guys are wondering.
Right.
There's plenty.
No one's going to wake up from anesthesia.
No one is. And I always say, I'm like, not only are you not going to wake up during the case, you are going to wake up at the end of the case.
That's when you want to wake up. I think what started this is there was a movie.
Yeah, I think it was with Jessica Alba or something.
Yes.
Recall.
Yeah,
or
we should find that movie
and just get rid of it. Just totally destroy it.
Because before that movie came out, I didn't really hear this question.
It's crazy.
And then it seems to it was around the time that movie came out, and then all of a sudden everyone started asking me about this, and I'm like, Where did this come from? Yeah.
Between that movie and Michael Jackson, like that's it. Those are the only questions that I get.
You know what? I'm so happy you brought this up because we remember that incident very well.
Oh, yeah.
But for some of our younger listeners, let me share a story with you. So Michael Jackson, the very famous musical artist, he died because he was receiving a medication called propofol to help him sleep. Yeah. And when that happened, a lot of patients were concerned. They would ask me sometimes, am I going to get propofol? And they were worried that somehow the propofol is what killed Michael Jackson. And that's not what it is at all. So it's really important for people to understand that what was going on with Michael Jackson was such an egregious, horrendous incident of care that it's beyond description or understanding. It's so bad that I remember when I heard the story the first time, and I heard that Michael Jackson was getting propofol at home. I swear to God, I heard that and I said, oh, they must have gotten that wrong. There's no way he was getting that medication at home. It's not possible.
I don't even know how you get it. Like, this is like, as an anesthesiologist, like I always, like, my joke is I'm as good as my drugs. Like wherever I go, the drugs are there. If you don't have the drugs that I can't use, I cannot anesthetize you. Right. I don't even know how you get propofol to administer in someone's home.
It's and no doctor in their right mind would give that medication outside of a hospital setting.
But
it's insane.
Not only giving that medication outside of not monitoring.
Right.
That was the most egregious.
Right.
So like there's, you know how in medicine we have the Swiss cheese model, like holes lining up.
Yes.
It was like literally all the holes lining up.
Every hole. Yeah.
Like all of the safety guards that we have, like the pharmacy should not have given it to a cardiologist.
Right.
You know, then a cardiologist is administering it. Then the cardiologist is also not monitoring. Like it's just like it goes one after another.
Yeah, it's incredible.
And there were so many holes and they were like really like right next to each other.
And huge holes.
Huge.
Right.
I don't know if there was any cheese in that model.
It's unbelievable. So the Michael Jackson case, the doctor that was giving it to him was a doctor that befriended him. He was paying this doctor a lot of money to help him sleep and be his doctor.
And
there was the
money
a big
comes
problem,
up again.
right? This doctor was not an anesthesiologist, so not really properly trained in giving these medications. The medication that he was giving should never be given outside of like an operating room or hospital setting. Then if it is given, it has to be monitored, meaning you have to have like oxygen levels being measured, heart rate, all that, which he wasn't doing. And then you don't give that to help someone sleep. I mean, it's like horrendous on every level. It
really, really is. And that's the thing. So like when people hear about anesthesia, they hear like the worst
the horror stories.
The worst.
Right.
But like I would not come here or do my job in an unsafe fashion. And I'm going to say that's the same for like all of my colleagues, like all of my colleagues, like they take pride in their work.
Of course.
Like we're doctors.
Right.
Like we didn't do that. You know, we talk about this a lot. Like I didn't go into medicine to be rich. Like it just, I mean, yes, I have a very comfortable lifestyle, but like that wasn't the end all be all. And I will I will not cut corners. Am I saying this right? English is my second language.
Your English is excellent.
I will not cut corners in order to save money.
Right.
Do you know what
100%,
I mean? Like
100%.
That's not who I am.
No, that's not who any of us are. And that's not who we would work with. I wouldn't work with you if you were that way, and you wouldn't work with me if I was that way. Yeah, that's right.
Yeah, because I've gone to places like that and I was like, see you later. Thank you for the day. I'm never coming back.
By the way, one of the episodes that I've done, and it just aired recently, was on horror stories from the ER. And I had an ER doctor on, and he was sharing like these horrendous cases he saw of patients who went to unscrupulous doctors and plastic surgeons, or doctors claiming to be plastic surgeons, and the complications he saw, and like all of the terrible things that these patients went through. And it's, you know, these things can happen if you go to a doctor who is not certified and not trained properly.
I have to say that it is so confusing.
It is confusing.
It's so confusing. Even I've been,
of course,
confused.
Yeah.
Yeah, I know. We've had this conversation. I'm like, oh my God, you're right.
Yeah.
They're not a plastic surgeon. I didn't even realize that.
Yeah. Yeah.
But
and that's a whole other topic.
I know that is. But I will say, like, I've learned cosmetic surgeon and plastic surgeon. I don't even look at cosmetic surgeon anymore. You know?
Right. That's right.
So I've gotten there. So
Yeah.
that's good.
Well, I think this is a good thing to bring up now because, you know, I'm a board certified plastic surgeon and you're a board certified anesthesiologist. And one of the things that I pride myself on and I share with patients is I always say to them when you have your surgery I really try to find the best MD board certified anesthesiologist to work with. And I'm proud of the fact that I've found incredible doctors like you, and there are others that have worked with me. And that's something I'm proud of and something that I tell patients. So I think if you're listening and you're considering plastic surgery, I think it's worth asking your doctor, what kind of anesthesia provider am I getting? I think that's a good thing to know.
100%, especially if that's the reason that's stopping you from making the life change.
Yeah.
You know, would you really want to do it under local? Like, it doesn't even make sense.
Right, right.
You would want the most skilled, most professional person in the room there taking care of you.
That's right.
So, like,
it's a no-brainer.
100%. Just like shoes on sale, face not.
Right. So the next thing, after patients tell me, after I cover that, after I say, okay, listen, that's not going to happen. You're not going to wake up. Then the next thing they say is, okay, well, I don't want to wake up in the middle of surgery, but I want to make sure I wake up at the end. Or, what if like something happens to me in anesthesia? So I always reassure patients. I say, listen, this is kind of what we already talked about. The way I approach patients is I get a medical history. I go through things. I'm trying to figure out if there are any risk factors. I think any good surgeon does that.
100%.
But we have checks and balances. And sometimes patients don't share all the information with me. Sometimes they hide it. Sometimes they don't know or remember. And that's why you come in, because then you come in with your set of skills and knowledge. You ask other types of questions. So there's like this, interaction and
totally.
This check that you provide, which is another layer of protection. So maybe share with the audience kind of like what you do as an anesthesiologist when you see a patient to make sure, okay, this case is going to be great. The patient's well, we're going to do surgery and it's going to work out fantastic.
Once again, it's such a pleasure coming here because like most of the work is done for me. It's all, all of the medical history, all of that. And I go see the patient and there are times, I ask about smoking, which I know we
ask about.
Yeah. You guys have that one down. Like that's a risk factor, alcohol and it's not like alcoholism that like I'm not, even just a few drinks. I just need to know. I tell patients like, I just need to know how much you take. I'm not judging. I just need to know how much to give you.
Right.
If you have a higher tolerance, then once again, there's a lot of anesthesia back there.
Right.
I'll give you more.
Right, right.
I'm not judging today. Today is not the day that I judge.
Right.
I just need to know what's going on. Yeah. And especially now with the big thing that is the GLP-1s. Patients really need to stop. So
these are the weight loss medications.
Yeah, the injectable weight loss medications. You need to be off of them for a week. That's really important.
Yes.
Because we need you to have an empty stomach before we do surgery because we don't want your stomach contents to make their way into your lungs and get a pneumonia.
Right.
We do things safely.
Yeah.
And so we ask not to take it for a week so that we can make sure that your stomach is actually empty before we do the anesthesia.
That's right.
That one's like a big one now.
Yeah.
And I've had to cancel surgeries over that because it's just not worth it.
Yeah. We ask that in advance. Right?
Yeah.
Yeah. Because we want to make sure as you said, my hope, I'm happy to hear that you feel like you come here and everything's done because that is my hope. I want by the time this day of surgery comes, I want every, like you said, every box checked, every T crossed, every I dotted. I don't want any surprises.
There isn't any surprise. I mean, except for that one patient that we had.
And it was because he misled us. Yeah. He didn't tell.
He did not tell us about this.
But we caught it.
We did.
Yeah.
And we did the right thing by him.
Yeah.
100%.
Even though he was not happy.
He was not happy. He was really unhappy.
But we were protecting him.
But exactly. We were doing what's best for him.
Yeah. I had a patient once. There's so many stories sometimes.
I know.
But I had a patient once where I was doing a consultation. And during the consultation, she revealed to me that she had it's a known bleeding disorder. And I said, oh, we can't do surgery on you, especially not cosmetic surgery. She was very upset and said, I was told that if I need surgery, there's medications they can give me. And I'm like, yes, if it's an emergency
surgery. If you need it.
Right.
If you need the surgery.
Life-saving surgery. But,
right.
but, this cosmetic case is not actually going to qualify for that. So patients sometimes get upset when we tell them they can't have surgery or maybe we should, get medical clearance or things like that. But we're doing it to protect the patient.
100%.
That's right. That's right.
At the end of the day, your job is to work, right? Yeah. But you're not going to, you are not cutting corners on people's lives.
Well, like you said, we're doctors and we take an oath to do no harm.
Oh, 100%.
So that, we're doctors before
any of the other stuff.
When we graduate medical school, right, we're not anesthesiologists yet. We're not plastic surgeons yet. We're doctors. And that is very important to people like us.
Yeah. 100%. Yeah. And I have to say, literally, when I walk in the door here, there's never a surprise. Some places I've gone, the histories have been, a little shady. Right. I get a little script that says cleared for surgery. Right, I'm like, what am I doing here?
Yeah.
Whereas when I come here, everything is just so perfect that yes, I am the second set of eyes, but I don't think I've had to, there hasn't been a time in all of the cases I've done with you.
By the way, I have not prepped her to say this. She is saying this by her own.
No, it's true. It's actually true. And you know me. I can't even lie. I can't. Right. Everything that comes out of me is just authentic. Yeah. And it's absolutely true. I've never looked at and been like, John, what were you thinking? No. It's not. That doesn't happen here.
Yeah. So would you agree? And I tell this to patients all the time. Surgery, so much of surgery is planning. It's preparing. By the time you're ready to start by the time I'm ready to start a patient's surgery, I've already done their surgery in my mind a couple of times.
Yeah. And I think
the same with anesthesia. Yeah. Right. And so would you agree that the reason we don't worry about anesthesia, the reason to us, it's the least of our worries is because we know that all that preparation we did before the surgery, all of those questions we ask, all the things we do to check, all the boxes we check off.
Or if we send you for medical clearance, there's a reason for it.
That's right. So by the time
something our spidey senses went up at one point and then you took care of it.
Yeah.
So that on the day of surgery, I literally just have to look at the monitor and make sure your vital signs are hunky-dory.
Yeah.
And that's it.
Yeah. And then I think the last thing that patients worry about sometimes is after they wake up, the nausea and vomiting and, I'm so worried about that. And I understand.
Oh, it sucks. I've had 3 children, nauseous and vomiting.
Yeah, it's not fun.
It's horrible. But we have drugs
right.
to counteract it. There's cocktails. And I give almost every patient, even the ones who don't even tell me that they're
prone to it.
I still give them the preemptive stuff. I give them something before I wake them up. And then there's even more medications to give in the recovery.
Right. We have a protocol that we follow. I think a lot of good surgeons follow it, and anesthesiologists, where you can give medications before the surgery, during the surgery, and then right after surgery. That really minimizes that risk.
100%. Yeah. I've seen the scopolamine patch. Right. They have that. We give them other drugs inside. And is it a risk? Yes. Honestly, that is... From the recall, the not waking up, this one I could say is a legitimate,
that
can happen.
Yeah. But I will say most of our patients, they don't, at least maybe I don't hear it.
Well, you see them afterward.
I see them after. They don't really complain about it.
And when I have them in the recovery room, they're pretty good. I have not, knock on wood, I haven't had one retching in the recovery room.
Yeah.
Ever.
Yeah. And one of the things I explain to patients is, because a lot of them, what they'll say is, when I had this surgery at the hospital, I vomited so much after. And I say, what I do is I explain, listen, a hospital is very different than what we have here, which is an ambulatory surgery center with a plastic surgeon, one provider, one doctor, one anesthesiologist. In a hospital, you're 1 out of 20 surgeries that day.
Yeah.
And they got to go. I mean, you need your surgery, but there's 20 other people waiting to get their surgery too. And they have to move fast. And they don't have the luxury of time to sit there and give you the different medications and make sure you got this before the surgery and make sure that they're titrating and measuring carefully what they give you and after surgery. No, they got to go. They got to go fast. And so in a hospital, if you have nausea and vomiting, they're kind of well, sorry, we have to do what we have to do. But when you come to an office of a good plastic surgeon with a great anesthesiologist, those experiences, it's a very different experience. It's a much more, I would say, almost like a luxury experience where you're getting really personalized care, personalized
it's
attention.
one-on-one.
One-on-one. You're the one patient.
I'm the one.
Right.
One patient
You
at a time.
Right, one patient at a time. You might be one of like 2 or 3 in the day, but that's nothing. That's something that we have plenty of time, the luxury of time to handle and take care of. So I think that's, I try to reassure patients, you're going to get a much different experience in this type of setting versus a hospital. So when you got your gallbladder, you cannot compare that to this.
Well, it's also, you've come in, when you're getting those type of surgeries, it's completely different.
Yeah.
Like, you're in a different headspace here.
Right.
There's different reasons why you're doing this.
Yes.
It's completely different.
Yeah.
And maybe some nausea, hopefully not.
Yeah. And if anything, that's probably the worst.
That is literally, okay. Like, honestly, like going through the whole list in my head of like risks of anesthesia, that is the one thing that I do say to the patients is you might be nauseous afterwards, but I do give.
We do everything we can to prevent.
We do everything to mitigate it.
Well, Diba, I think we tackled it.
Yeah.
We covered it.
We did it.
We did it. We covered
great.
a lot. I'm happy we did this because I want to share this information with patients. So many patients they don't understand anesthesia. They're scared about it. They have these worries, these fears. And I hope that anyone listening to you today is like, okay, wow, that makes sense.
I hope so. I mean, I did go to a lot of schooling.
She knows what she's talking about.
That's true.
Yeah. Well, I have to say, it's been a pleasure talking to you.
Well,
like I said, you are like the consummate professional, just an incredible anesthesiologist, not only incredibly skilled at what you do, but so kind and nice to patients. It's really an honor to work with someone like you.
And I love working with you.
Great.
The feeling is completely mutual.
All right. Well, thank you so much, Dr.
Thank
Diba.
you.
All right. And thank you all for listening. I hope you enjoy that. And please follow, stay tuned, subscribe, and look out for more episodes.
This is the Plastic Principle.